Assalamualaikum warahmatullahi ta'ala wabarakatuh. Good day to each and everyone. So in this video, i-discuss ko yung nursing process. I know that we have already discussed the nursing process as it has been discussed by your classmates, okay, yung mga reporters regarding the nursing process theory. But I want to discuss it further and to intensify your knowledge about it because it's very important that you know this concept. Kasi nursing process is a very important process na ginagawa ng mga nurses on day-to-day basis or a routine, okay, na ginagawa ng mga nurses para makadeliver ng enough na services sa ating mga patients. So what is nursing process? So a nursing process or the nursing process is a systematic method of planning and providing care to clients. So this process is used per client. Okay? It is individualized na plan of care. Okay? So its purpose is to provide client care that is individualized, holistic, effective, and efficient. So without using this kind of process, without using the steps, okay, na sinusunod mo yung mga iba't ibang steps or phases ng nursing process, hindi ka makaka-derive ng plan of care para sa mga patient ninyo. Okay? So, the purpose of nursing process first is to identify a client's health status. So it's very important that you are able to assess the health status of your patient para alam natin kung ano yung needs niya, okay? Next is to establish plans to meet the identified needs. So syempre alam mo na yung health status ng patient mo, alam nyo na yung mga health needs niyo through the assessment. So doon ka makakagawa ng mga plans of activities na pwedeng ma-implement sa inyong patient to improve his or her well-being. Another is to deliver specific nursing interventions. It's very important that our nursing interventions are organized into independent, dependent, and interdependent na mga implementations or interventions. Okay? So, what are the phases of nursing process? So, we have the mnemonics ADPI. Okay? ADPIE. Okay? A stands for assessment. D stands for diagnosis. P stands for planning. I stands for implementation. And E stands for evaluation. Okay, so isa-isahin natin itong mga phases ng nursing process. So let's start with assessment. Okay? So ano ba si phase ng assessment? So assessment is the process of collecting, validating, and recording data about a client's health history and health status. Again, ito yung proseso ng pagkalam natin or pagkuha natin ng mga iba't ibang data or mga information regarding your patient. It's either based on the patient itself or their records. Especially kung yung mga patient mo is labas-pasok sa hospital at may hospital records, pwedeng gawin mong basehan ng mga information na kailangan ang health records ng ating patient. So paano ba ma-collect ang mga data? What are the methods of collecting data? First one is through observation. So using your senses, the sense of vision, the hearing, okay? So yun yung mostly na nagagamit natin ng mga senses natin. Tsaka na yung mga sense of touch, okay? Sense of touch, vision, hearing, the smell. Okay, syempre hindi na natin magagamit yung gustatory or yung taste kasi hindi naman natin nilalasahan yung ating patient. Okay, next one is interviewing. By asking your patient. Dito, dapat ang mga nurses are able of communicating with your patient. You need to establish rapport or you need to establish trust between you and your patient. It's very important kasi once hindi ka maka-establish ng rapport or trust, hindi mo makukuha yung gusto mong data. Okay? So, dapat yung mga nurses have good communication skills. That's why it's very important that you, nurses or student nurses, are practicing communication skills. So, kailangan na-improve ninyo the way you talk with your patient because if you don't talk with your patient, then wala kayong makukuhang data sa kanila. And lastly is through examining. Itong examining na to, hindi yung magbibigay ka ng examination. It is not, okay? Ito is the physical head-to-toe assessment. So, i-assess mo yung patient mo from head to toe. So, yun na yung pag-aaralan ninyo next semester on the health assessment. Okay? So, what are the types of data na pwede nating mag-gather sa ating patient? So, we have two types of data. It's either subjective or objective. Pag sabihin nating subjective data, ito yung mga data that refers to information from the client's point of view. Okay? Meaning, hindi mo siya makita, hindi mo siya ma-feel kasi the patient only feels or knows about it. Okay? So, example, feelings, perceptions, concerns. We all know that feelings, perceptions, and concerns are very individualized. Kahit magkakapareho pa ng kaso, kahit example, sabihin natin, lahat sila hypertensive. But, kung ano yung nafe-feel nila with their sa katawan nila, pangangatawan nila, magkakaiba. Pwede yung isa, nararamdaman nila lang is sakit ng ulo, yung isa, nagsusuka, yung isa is nahihilo, nagkakaiba sila ng mga concerns regarding their health. So, ano yung methods para mag-gather itong subjective data? Through interview. So, ginagawa natin once we gather the subjective data, okay, masakit ang ulo ko as verbalized by the patient. So, yun yung ating subjective data. Once you i-document the subjective data, ganun yung pag-document. Masakit ang tiyan ko as verbalized by the patient. Okay? Hindi mawawala yung as verbalized by the patient and quote and quote. Kasi hindi ikaw yung nagsabi. Hindi siya magiging subjective data once sabihin mo the patient is having back pain. So, it's not a subjective data. There, ginawa mo siyang objective data. Okay? So, examples, headache, nausea, and dizziness. Another is the objective data. This refers to observable. Again, observable, meaning nakikita ninyo, no? Observe ninyo, and measurable information that is obtained through both standard assessment techniques and the results of laboratory and diagnostic testing. Okay? So, method, paano? It's either physical assessment or assessment through IPA or EAPIPA. Ano tong IPA or EAPIPA? So, I stands for inspection. Okay? So, through the use of your vision. P stands for palpation. Okay? Through the use of your sense of touch. So, hahawakan mo. It's either deep palpation or light palpation. Next, another P is percussion. Okay? Percussion. So, yung percussion na method, yan yung pag-strike natin ng isang object sa gusto nating area or target area natin to elicit sounds. And yung sound ang pakikinggan natin kung ano yung kanyang characteristic. It's either dull, okay, timpani, okay, hyperresonance, resonance. So, yan yung kinakarakterize natin sa mga percussed sounds natin. And lastly is A stands for auscultation. Pag sabihin natin auscultation, yung pagririnig or pakikinig natin sa mga sounds na napoproduce sa ating katawan through the use of your stethoscope. Again, I stands for inspection, P stands for palpation, another P stands for percussion, and lastly is auscultation. Ano tong EAPEPA naman? Yung assessment kasi sa ating katawan, magkakaiba yan siya. On the general parts, ang ginagamit natin is the IPA. Okay? Pag naman sa abdominal region, meaning dito banda sa ating tiyan, ang pag-assess natin dyan is EAPEPA. Yan yung order niya. Magsa-start tayo with inspection, then tsaka tayo mag-auscultate, then tsaka tayo mag-percuss, and then last na yung palpation. Bakit hindi katulad nung general no order of assessment? Okay? Bakit hindi magkapareho? Kasi kailangan in assessing the abdomen, you should start with auscultation para marinig mo yung sounds. Because remember, our organs, internal organs produces sound. So, once mauna yung palpation percussion, nag-change yung sounds na nai-elicit ng specific organ dito natin sa abdomen. So, pwedeng yung bowel sounds natin is maging hyperactive because nagkaroon ng stimuli in which hinawakan mo siya, gipercuss mo siya before auscultating. So, na examples ng objective data, we have vital signs, we have redness of skin, vomiting. Okay? So, yung mga vital signs, yan yung kasama dyan yung pag-check ng ating temperature. Okay, first natin yan. We have the BP, okay, or the blood pressure. The next, we have the HR or heart rate, yung beats ng heart ninyo. And we have RR or respiratory rate. So, ilang cycle ka huminga. So, 1 cycle is inhale, exhale. So, once yan. So, 2, inhale, exhale naman. Then, bibilangin mo yan siya in in 1 minute. Okay, and we have also the pulse or oxygen saturation. So, with using your pulse oximeter, chine-check ninyo yung oxygen level sa inyong blood. Okay? Ay, sa inyong katawan. So, yan ang ating objective data. Okay? So, what are the sources of data? It's either primary. Pag sabihin natin primary, this data coming from the patient itself. Okay? Sa mga pasyente lamang. Next is for the secondary. Sa secondary naman, yung mga family members ng ating patient. The friends, the relatives, kung sino man ang may alam sa health condition ng ating patient. And lastly is secondary din is under, isa din sa mga secondary sources of data is your medical history, okay? The past medical history or yung health records ng ating patient. And also the members of the healthcare team. Okay, so yun yung all about the assessment. Now, let's go with the phase of diagnosis. So, diagnosis, it refers to the interpretation and analysis of data that have been collected. So, it's very important that you should analyze or interpret the data that you have gathered. Kasi hindi natin, example, nakuha natin, okay, the patient has headache. Yun lang. So, kung hindi mo siya i-analyze, you cannot derive to a plan na, okay, ang headache niya pala is very intense na with the pain score of 10 out of 10, na 10 is the, 10 is the maximum or pinaka masakit, pinaka worst na pain. At yun yung nararamdaman ng ating patient. At yun ang ginagawa natin on diagnosis. We interpret, we analyze the data that we have gathered sa ating patient. Example lang natin kung kumuha tayo ng BP niya. Okay, 100/80. Is that normal or normal? So, pag sabihin natin data in assessment, ang kinukuha lang natin is raw data. Okay? Yung raw lang, meaning hindi pa siya na-analyze. Once we go to diagnosis at na-analyze na natin, okay, 100/80 is normal. So, the patient does not have problem in his or her blood pressure. Pero nakita ninyo, okay, may problema siya sa respiratory rate niya kasi umabot ng 35. So, the normal for an adult is 20. So, meaning your patient have rapid breathing. So, dun pa lang, okay, malalaman mo na ang problema ng inyong patient. So, mabilis yung kanyang paghinga. Bakit kaya? It's either may ubo siya, okay, may sipon siya, merong mga mucus dyan sa kanyang ilong or sa kanyang throat na naka-obstruct dyan kaya hindi maganda ang kanyang paghinga. So, dito ginagawa yung pag-analyze this diagnosis phase. So, its purpose is to identify health problems, risks, and strengths. So, the outcome of this phase is making a nursing diagnosis out of the data that you have gathered through or in the assessment phase. So, ang paggawa ng nursing diagnosis natin is based sa NANDA or sa libro na NANDA na binigay ng ating mga standard na mga nursing diagnosis na usually na-apply sa ating mga patient. Kung wala man sa libro, meaning hindi pa siya standard na nursing diagnosis. So, NANDA stands for North American Nursing Diagnosis Association. Okay? So, what are the components of nursing diagnosis? So, we have 3 components of nursing diagnosis. So, first one is the problem. So, dito, it describes the client's health problem or response. This may require specifications such as deficient, impaired, decreased, ineffective, or compromised. So ito yung mga qualifiers na binibigay natin or nilalagay natin sa ating nursing diagnosis that gives additional meaning to the problem. Example, deficient knowledge. Okay, kasi ang problema ng patient ninyo is hindi niya ma-follow yung tamang pag-inom ng gamot because lack of knowledge, deficient knowledge. Impaired mobility kasi hindi siya makagalaw because he or she is a stroke patient. Pwedeng gamitin natin yan. Decreased blood volume. So, masyadong mababa ang kanyang, yung blood na dumadaloy sa kanyang katawan. Ineffective breathing. So, pag sabihin natin ineffective breathing, meaning hindi maganda ang kanyang paghinga. Okay? It's either mabilis or mabagal. And compromised. Okay? Compromised mental status. Okay? Pwedeng depressed yung patient ninyo, merong anxiety. So, yung mga qualifiers na yan, yan yung nagbibigay ng dagdag meaning sa problem ng inyong patient. So, after problem, another component, after the problem, sinulat mo, example, deficient blood volume. So, ano yung etiology? Meaning, ano yung reason bakit bumaba ang kanyang blood volume? So, ito yung etiology. It identifies one or more probable causes of the health problem. This gives direction to the required nursing therapy and enables the nurse to individualize the client's care. Diba sinabi ko kanina na kahit pare-pareho pa ng case na hypertensive yan, it depends on the concerns. Magkakaiba yung concerns. So, doon pa lang malalaman ninyo, mas napapabigyan ng ibang, direction yung care at, magiging individualized yung plan of care mo pag malaman mo kung ano yung cause kung bakit naging ganon yung patient ninyo. Ano kaya yung naging cause ng pagbaba ng kanyang blood volume? So, pwedeng due to or related to motor vehicular accident. Kaya masyadong mababa yung kanyang blood, it's because na-aksidente siya. Pwede din na yung, kaya bumaba yung blood is due to narrowing of the blood vessels kasi yung patient mo may atherosclerosis. So, ang daming reasons bakit pwedeng bumaba yung blood volume ng inyong patient. Ang daming reasons bakit nagkakaroon ng ineffective breathing yung ating patient. It depends on the etiology. So, last component of nursing diagnosis is your signs and symptoms. So, this is the defining characteristics and nilalagay natin to siya sa nursing diagnosis natin with the phrase as evidenced by. So, this is joined to the first two parts. So, example lang natin ha. So, deficient blood volume related to motor vehicular accident as evidenced by poor capillary refill. Okay. So, yun pa lang, nakagawa ka na ng isang nursing diagnosis. So, problema ninyo, decrease yung blood volume. Bakit? Kasi nagkaroon siya ng motor vehicular accident. Doon pa lang malaman ninyo na, okay, ang aking patient is a victim of motor vehicular accident. So, ano yung evidence na nakita mo na poor yung kanyang blood volume? One evidence na nakita ninyo is the poor capillary refill more than 10 seconds or more than 5 seconds. Okay? So, ito yung mga examples ng ating nursing diagnosis. Okay. So, ito mga problem lang. Tapos, ito dinagdag natin yung etiology. Ito na yung complete na nursing diagnosis. Example, ineffective airway clearance. Dinagdagan natin ng etiology related to retained secretion. Dinagdagan natin ng signs and symptoms as evidenced by nasal flaring. So, itong RT, okay, it's related to and then AEB as evidenced by. So, tatanungin nyo ako, ma'am, pwedeng ganyan? Yes, pwedeng ganyan lang. Para at least hindi masyadong mahaba yung pagsulat mo ng nursing diagnosis ng inyong patient. So, we have another example, deficient knowledge related to misinterpretation of information as evidenced by inaccurate return demonstration. We have also another, spiritual distress related to separation from religious ties as evidenced by crying and with withdrawal. So, ang dami-dami nating mga nursing diagnosis. If you have your books with you, or pwede kayong makapurchase ng libro na Nanda, madami tayong mabibilhan dyan. Okay? So, it's good na meron kayo para at least alam ninyo na, okay, ganito pala yung mga iba't ibang nursing diagnosis, and you are able to know ano yung mga pwede ninyong gamitin once you do have your duties in the hospital. Okay, so what are the types of nursing diagnosis? So, madami tayong mga types of nursing diagnosis. The first type is the actual nursing diagnosis. So, pag sabihin natin actual, this is the client's problem that is present at the time of the nursing assessment. So, example lang natin, yung patient mo nagreklamo, may headache siya. So, ang actual na problem niya, pain. Okay, kasi pain related to ano kaya yung naging cause ng kanyang headache. So, yun ang actual nursing process. So, example, acute pain related to fracture, ineffective airway clearance related to retained secretion or retained mucus secretion. So, next type of nursing diagnosis is risk. Okay, from the word risk, kumbaga, wala pa yan siya. Hindi siya actual na problem ng inyong patient, but there are something or some health factors that can contribute in developing this actual problem. So again, it indicates that a problem does not yet exist, but special risk factors are present. Example ng isang risk nursing diagnosis. We have risk for infection related to chemotherapy patient treatment. Example lang natin, iba yung mga pasyente natin na nagkakaroon or may cancer na nag-undergo ng chemotherapy. So, chemotherapy further, kills. Ang ginagawa kasi ng ating chemotherapy, pinapatay niya yung mga cancer cells. Pero in doing so, meron din siyang napapatay ng mga normal cells. And dahil namamatay yung ibang normal cells, nagiging deficient yung ating immune system in fighting infection. That's why we are at risk of developing infection. We have also risk for impaired skin integrity related to immobility. So, yan yung ating risk nursing diagnosis. Another type of nursing diagnosis, we have wellness. So, this indicates a client's expression of a desire to attain a higher level of wellness in some area of function. So, dito tayo, nagbibigay natin to or na-formulate natin tong mga nursing diagnosis na to once our ating patient is ready na, okay, or getting well na siya, okay? So we have examples such as readiness for enhanced family coping and potential for enhanced nutrition. Okay, so next type of nursing diagnosis, we have possible. So possible is a statement about a health problem that the client might have now. So might have now, meaning maybe meron siyang ganito. Bakit hindi natin masabi na yun talaga yung actual na problem niya? Kasi we don't have enough evidence. So the nurse doesn't yet have enough information to make an actual diagnosis. That is why it is possible lang. Again, magkaiba si risk at saka si possible. Kasi si risk, meron ka ng risk factors na nakita. While as sa possible, wala ka pa masyadong nakita or hindi ka pa masyadong nakagather ng enough data sa ating patient. That's why possible lang na magkaroon siya ng ganitong problem. Okay? So example lang natin, we have possible self-esteem disturbance related to recent retirement and relocation. Okay? Next type of nursing diagnosis, we have syndrome. So, syndrome is used when a cluster of nursing diagnoses are often seen together. Example, rape trauma syndrome related to anxiety about potential health problems as manifested by anger, genitourinary discomfort, and sleep pattern disturbance. So, yun ang 5 klase or types ng ating nursing diagnosis. Now, let's go with the phase of planning. Okay, letter P, planning. So planning is the process of developing, prioritizing plan of care, and establishing smart goals in order to achieve a desired outcome. The SMART stands for S, specific. Okay? So dapat yung specific na mga goals na attain natin. M stands for measurable. So kailangan yung goal natin is hindi imaginary. Kaya nating maabot. Okay? A stands for attainable. R stands for realistic. Okay. Yan. Makatotohanan at base sa totoong nangyari or true event. And lastly is T, time-bounded. Ang ating nursing care, okay, is time-bounded. Hindi siya pang lifetime. Kasi hindi naman lifetime na nasa hospital ang ating patient. That's why we do have a limitation in our time. Okay? Kasi hindi magiging independent ang ating patient pag sa sobrang haba ng time, ando dun ka in their side. Remember na ang goal natin is the dependence, makadevelop ng independence ang ating patient para siya na yung capable of having decisions or giving interventions para ma-promote ang kanyang well-being. Okay? So the planning phase involves several tasks such as prioritizing the list of nursing diagnoses. So, i-prioritize natin yung pinakamalaking problem niya. Okay? Hindi yung problem niya is sa malayo sa bituka, yun ang inuna mo at nakita mong nagbe-bleeding siya, hindi mo inuna yung pagbe-bleeding niya. So, hindi yon. We need to prioritize kung ano yung number one na sa nursing diagnosis mo na very needed na ma-assess ng ating tayong mga nurses. Another is formulating goals and desired outcomes. So, it's either mga outcomes natin for long-term goals or short-term goals. Another is developing specific nursing interventions. So, dito pumapasok yung mga iba't ibang interventions na gusto nating i-implement sa ating patient. And lastly also is recording the entire nursing care plan in the client's record. So ito yung tinatawag nating nursing care plan na ito, inshallah, you will be doing this, okay, once you have already, once you have already achieved your capping ceremony, tapos magjo-duty na kayo sa hospital. So, dito sa Qs, dito natin nilalagay yung mga subjective and objective data natin. So, example lang natin na nilalagay natin dito, subjective data. So, masakit ang ulo ko as verbalized by the patient. Objective data dito yung mga vital signs at saka yung mga iba't ibang observed na nakikita mo. Example, facial grimace, kasi in pain nga yung patient ninyo, irritable yung patient ninyo, pwedeng may weakness or body weakness. So, yung mga iba't ibang mga objective data. So, dito sa nursing diagnosis, yung ginawa natin kanina, example lang natin is ineffective airway clearance related to retained secretion as evidenced by nasal flaring. Example lang yan ng ating nursing diagnosis. So, dito sa objectives natin, ano yung goal natin? So, based diba sa ating planning, it's either long-term or short-term. So, ano yung gusto ninyo? Kung pang matagalan ba na magsasama kayo ng patient? So, pag matagalan, pwede kayong mag long-term goal. Pero pag maiksi lang kasi 8 hours of duty lang or 6 hours lang or 12 hours lang. So, that is your short-term goal. So, dito sa mga intervention, syempre, kasama to sa pinaplano natin. Ano yung mga iba't ibang interventions na pwede nating i-facilitate or implement based sa nursing diagnosis natin. And then next, we have dito, nakikita nyo, rationale. Each intervention should have rationale. Pag sabihin natin rationale, the reason bakit natin ginawa yung specific na nursing intervention. And lastly is the evaluation. Ano yung gusto ninyong mangyari sa pasyente ninyo after delivering the specific nursing care. Okay? So, ano yung mga klase ng nursing intervention. So, first, we have independent. Pag sabihin natin independent nursing intervention, ito yung mga interventions na solely ang mga nurses lang ang nakakagawa or yung gumagawa. So, next, pag dependent naman. Itong mga dependent na to, these are type of intervention that depends on the doctor's order. And lastly is the interdependent. So, these are types of interventions that are multidisciplinary or at what we call this, it needs the team or the healthcare team to move, okay, para ma-implement ito. Okay? So, yan ang tatlong klase ng nursing intervention. We have independent, dependent, and interdependent. independent. So let's go with the implementation phase. So implementation phase involves the execution of the nursing care plan derived during the planning phase. So kung ano man yung napaplanuhan ninyo during the planning phase, ito na yung pag-implement natin. So it consists of performing nursing activities or nursing interventions that have been planned to meet the goal set with the client. Okay, so the last activity of this phase is documentation. We nurses do not forget documentation. Why? It's very important that we have documented all the process or all the activities that we have done to our patient para doon natin makita yung improvements ng ating patient. Without proper documentation, magkakaroon tayo ng problema in implementing nursing care. Wala tayong ebidensya. Okay? Dito is, what is not written is not done. Okay? Yan yung motto natin ng mga nurses. Kung hindi man siya nasulat, hindi siya nagawa. Okay? Kung nasulat siya, meaning nagawa siya. Okay? So, mind you ha, again, what is not written is not done. So, kung ano man yung nakita mo na hindi pa nasulat, meaning hindi natapos, so gusto mong gawin, you can do it because it is not done from the previous shift. Okay? So, last na phase ng ating nursing process is the evaluation. So, dito, it involves determining whether the client goals have been met, partially met, or not met. So, lahat ng mga na-establish ninyong goals, mapa-short term man yan or long term man yan, dito nyo i-check, i-evaluate ninyo, titingnan ninyo kung na-achieve ba yung gusto nyong mangyari, okay? Or partially achieved or not met. Okay? So, I think that ends my discussion on the nursing process. Again, itong ginawa kong video is to intensify your knowledge on the nursing process because once again, this will be, discussed furthermore at lagi itong dinidiscuss sa field of nursing. Okay? So, please, please, please do memorize this nursing process because it will help you a lot once you become a nurse, inshallah. Okay? So, thank you for watching this video and have a nice day.